I've had the privilege of working with a number of organisations, both at a national and international stage and platform. I did a master's at the London School of Economics, as well as the London School of Hygiene and Tropical Medicine. I've also worked for NHS England, particularly my local CCG, as a project manager, and I was overseeing a £20,000 budget for the whole Staffordshire region. I've also worked as a civil servant as well, particularly with the Human Fertilisation Embryology Authority. I worked in part of the intelligence team, and I was overseeing a research project looking at the use of single embryo transfer to reduce the multiple birth rates. I've also been a scholar with HLA, Healthcare Leadership Academy with Scholar, and then I went on to chair the most recent international conference where we were looking at health workforce and health policy. I've also worked in an international organisation called the International Working Group for Health Systems Strengthening, which is a group of young public health professionals working closely with Johns Hopkins University, which is a leading institution in America. And I was on the European Committee, part of that steering committee. Also worked in the BMA as Medical Students Committee. I was the deputy chair, worked at Christian Medical Fellowship, which is a national charity looking after Christian doctors. I've worked closely looking and reviewing the charity and the governance and seeing our board recruitment. And I'm also the founder and director of the Aspire Medic Support, which is a registered community interest company supporting socioeconomically disadvantaged students. And we essentially help to support them get into medical school and widen the aspirational gap. So